Testing for diabetes started a long time ago. The word diabetes comes from ancient Greek, which literally means pass through, intended to mean the excessive passing of urine. This characteristic of too much urine was first described 3,500 years ago on an Egyptian papyrus. About 1,900 years ago, Roman physician Galen called it diarrhea of the urine. The reason for so much passing of urine with diabetes mellitus is because high levels of sugar in the blood overwhelm the kidney's ability to keep sugar out of the urine. Like a dam on a river, sugar spills over the dam into the urine when sugar gets too high in the blood. And then, with concentrated sugar in the urine, fluid is pulled out of the blood into the urine, resulting in dehydration of the diabetic. Indeed, the name diarrhea of the urine seems appropriate. About 2,500 years ago, someone noted flies were attracted to the urine of diabetics. Tasting urine for sweetness may seem disgusting today, but it was how they diagnosed diabetes all the way through the Middle Ages. It was English physician John Roll in the 1700s who added mellitus to the term diabetes to reflect the age-old understanding of the sweet taste of the urine in diabetic patients. The word mellitus comes from Latin, meaning sweetened with honey. Starting in the 1950s, patients roughly estimated the level of sugar in their blood by testing their urine with a chemical test they could do at home. By defining how much sugar spilled into the urine, people with diabetes mellitus were better able to adjust their insulin dose. Home urine glucose testing was an improvement for patients with diabetes, but home blood glucose testing, developed in the 80s, took us to the next level. Patients could finally know when sugars were too low, not just too high. Another great improvement in monitoring sugar in people with diabetes was the discovery of the hemoglobin A1C blood test. The hemoglobin molecule within red blood cells becomes more sugarized, the scientific word is glycosylated, when it has extended exposure to higher levels of sugar. Since red cells normally live about 3 months before the spleen removes and destroys the old red cells, this allows measuring the percent hemoglobin affected by sugar to change slowly according to diabetic control. The hemoglobin A1C levels give a 3-month average blood sugar, which gives you and your care provider a good measure about how well you're controlling your diabetes over time. It's a good thing managing diabetes no longer requires tasting urine.